Ford Allegiance Health Emergency Department, Clinical Nurse Manager Joanna Plate, and Patient Advocate Jill Phillip. Welcome.
Thank you.
Thank you.
Great to see you. I found out what a patient advocate is this past year with our family, and had opportunity and occasion to be in the hospital. And I didn't even know we had a patient advocate program. What is it? How would you define what a patient advocate is, Joanna?
So a patient advocate is something we recently adopted. We learned it from our Henry Ford Health System partners. And it is a role in which the advocate kind of bridges the gap that the nursing are taking care of the patient or the family member, and the patient advocate will kind of bridge that gap on what the next steps in the care are, answer any questions that the family may have, and allow the nurses to be at the bedside, completing the treatments and doing the care when they're always worried about that piece, but they just didn't have enough time to get to that piece. So it's a nice added enhancement to patient care for our families.
Is a patient advocate a clinician?
Right now they are non-clinical. We felt that was important because we thought that the non-clinical people will see the other side a little bit better than the clinical people at the bedside. We see things differently, and it helped us identify some areas where we could close that knowledge gap for patients and families.
And Jill is a great patient advocate.
She's wonderful.
Yeah, you're one of their stars.
She was our first, yes.
Oh,
She's doing a wonderful job.
How did you get into this role, Jill?
Well, I've always been interested in kind of a back to basics approach to patient care, and when I interviewed with Jo, she supported that very much. And sometimes in the busyness of delivering expert clinical care, it's some of those soft skills, keeping the seam side away from patients, making sure all those comfort items are there, listening to the family, listening to the patient about what appointments they may be missing while they're, for example, in the emergency room, being able to make those phone calls for them if they want us to, taking care of some little details, and trying to make their visit as stress-free as possible.
Yeah, because when you're in the emergency department, no one plans to go to the emergency department.
Right.
The rest of the hospital maybe, but the emergency department, it wasn't on the Google Calendar that day.
That's right, and sometimes there's a lot of little details. There's pets at home, there's all kinds of things that patients are worried about, and we try to, like I said, make the visit as stress-free as possible by attending to some of the non-clinical situations that may affect the patient's ability to focus on their health.
And I think one of those, Joanna, and you see it, there are people that are in the emergency department and they're waiting. It's a waiting game. And I think that probably is one of the number one questions and concerns that maybe a patient advocate would be able to handle.
Absolutely. And what we do is we analyze different waiting patterns from the waiting room and patients waiting to go upstairs. And we have actually identified certain times of the day that Jill and her group will go out to the waiting area and speak with various family members, just to kind of let them know what they're waiting for, what the next steps to treatment are. They maybe help us bridge, like communication to a physician if there's something that's changing. So they help out quite a bit in the lobby, just to kind of ease the anxiety of the patients who are waiting.
Yeah, and there's two kinds of citizens in Jackson County, those who have been to the emergency department and those who will be to the emergency department. We're all going to go through there someday. And the day we were there, Jill was great. Our family, we had an emergency and everyone is fine. But that day, it was busy. What was going on? It was like a flu epidemic.
It was during flu season, and you were all very gracious, and part of what you saw that day is managing a large family and assisting them that's there for their loved one, finding out maybe who the core communicator can be so we can spread the word out to everyone through one person, It was very busy there, and I believe that our hospital was full as well, and we had patients waiting in the emergency room, which really kind of turns the emergency care into like a med-surg unit, sort of. And it really, our nurses are fabulous, and they go between these roles seamlessly, but it does get very busy, and it probably, to the patient and their family, looks like a controlled chaos situation, but it is controlled very well, and that's what our role is, to help facilitate and explain kind of what's going on, so, and keep an eye on, the patient's flow, the throughput through the hospital.
Yeah, there's a lot of behind the scenes a patient or a family member never sees, and there's a lot of behind the scenes that without that the department wouldn't function very well.
Right.
It was also, I think, there was some construction going on in the ED.
Always. We always have something going on. There's always some sort of construction, or even within the hospital, that would make navigating, even for families, a little bit different. And our advocates is certainly stay up to date on all of those type of things. It changes daily, and they do a really good job at helping patients navigate through the system.
Yeah, and we don't really understand the clinical side of things. When someone's dealing with traumatic injury, we're looking at patients lined up and thinking, well, our case is more serious than that. Can we just move that gurney, and can you just shuffle things around? But that's part of your job, explaining how and why the wait is occurring.
That is correct. We need to, as a patient advocate role, we need to stay out of the way of the trauma team. However, maybe provide some information from the families and provide care to the family and keep them updated. And Joe certainly would be able to speak more on that than myself.
So if we have, we are a level 2 trauma center, and we've been newer to that role, and certainly busy with that piece. And the patient advocate role with that type of situation is vital. If you've ever been a parent or family member waiting out front that you heard that your loved one was in an accident or anything, that few minutes waiting out front seems like an eternity. You have so many questions, and you're so worried. The staff and the trauma team are in with the patient, and this is where Jill's role comes, and it is so vital to that family to get somebody out there as soon as possible, and they'll meet them in the front, to hopefully decrease their anxiety a little bit, and then they go back and forth from the room, from the trauma room to back to the patient, and let them know what's going on. And also in that time, they also go out into the lobby, and they will talk to other families that are inquiring, what's going on, what about me? Assuring them that everybody there is an emergency in their own mind, and we treat that way, and they will help with that and ease their wanting to leave and things like that. So we really take that seriously, and our physicians are quite engaged, and also coming out to the lobby and talking to families about waiting times or any other issues.
Really, and that's probably the most number one thing people want, is just to know what's going on, and that's where you come in.
We try.
Yeah, and you do a great job of that. And it's not just in the ED. I was just telling Joanna before the show that Jill will follow the family through the hospital and wherever they end up. It's not just in the emergency department that you're working as a patient advocate.
Well, no, I work for the emergency department. However, one feels protective once you've spent hours with a patient and their family. So, the culture is to follow the patient up there when we can and make sure they're settled in. And of course, the handoff is always, our nurses are excellent on our units, and the handoff is always smooth. So, but it's you've spent sometimes some of the most critical moments of a person's life with them in the ER, and I just want to see them tucked in upstairs.
Well, I think you're a great person to be the first patient advocate, because you have a lot of background and really the personality and the skills to be the model for future patient advocates.
Absolutely.
How many do you currently have?
We have just hired my last one, so we have a full complement of 4 at this time. I would love to see it expanded and adopted throughout the hospital. I think it would be a wonderful addition to our patient-centered, family-centered care model. So we're going to be full up and running, so there will be somebody 24/7. So they can always come in, and if a patient, no matter the complaint, there's no issue. Just ask for a patient advocate if you are inquiring and have some, concerns at home. You need to get a hold of somebody, and you don't have a phone. Those kind of things will certainly help them out.
Yeah, you're fully busy. It's a handful for the 4 that you have on staff. You've had a lot of rewarding experiences.
Most definitely.
Yeah, so does something stick out of a family situation where you felt like, wow, I made their day?
Well, they usually make my day, is how that works. So I should be the one sending thank you notes to them. However, I do have patients text me, because sometimes our hospital cell phones are difficult for the patients to communicate on in the middle of a crisis. So I'll give them my cell phone number so we don't lose track of each other. Many times they have to move cars, they have to maybe run and get a family member that's coming or something like that. So, and then later they'll text me and tell me when they're thinking back on that day. So that's very rewarding that you've helped someone with those moments. But there's just so many rewarding experiences. Oh, I think probably the most rewarding experience was one time I had a patient who was extremely upset because it was her 65th wedding anniversary.
Oh, wow.
So we managed to arrange a wedding anniversary party for she and her scallywag husband that she'd been married to for 65 years. What a wild one. And we managed to arrange a 65th anniversary catered party for them. And it just happened that the Joint Commission showed up that day. And in the middle of a Joint Commission inspection for a hospital, that's a big deal. Even President Trump couldn't trump a Joint Commission inspection. But this went on at the same time, but our CEO came to the anniversary party, and even one of the Joint Commission surveyors. So that was a pretty rewarding day to be able to do that. But special things,
Yeah, well, and there's a great example of above and beyond. And in our family situation, Jill gave us her cell phone number, and you stayed in contact with us. And even though I know you weren't pulling strings, but it made it. We felt like you were pulling strings and using your relationships throughout the hospital to make the process just a little bit better.
That's great. Well, thank you. Your kind words mean a lot, but I'm just only a small part of a huge group of people that do this. Everyone, our environmental services, our nutrition services, I can turn any time throughout the day to a huge number of people that are there for that patient, and it's a great feeling. And Jo's been wonderful. She lets us run with ideas and investigate them. And
well, I know it's the hospital is, everyone in your department, very excited to have this program, and we're glad that the community now has it and now knows about it.
Right.
Thank you for coming. What'd you bring? Did you bring lunch?
oh no, I brought.
present.
It's National Hospital Week, and I thought you all deserved maybe just a few little things from the hospital.
Tokens from
Oh.
the
Little
hospital.
Little tokens from the
yeah.
hospital for you all. But Jo didn't know I was doing this, so she insisted upon going through the bags before I brought it out here, because I think she was afraid of what I might have put in it. I mean, I wouldn't have brought anything
Well, I've always
back.
wanted a stethoscope.
Oh, really?
Yeah.
I'll see what I
You know
can
what?
do. We'll get you a special stethoscope.
That's right. But she might have to teach you how to listen for breath sounds and heart rates. But yeah, so just a few things.
Thank you. And happy National Hospital Week.
Thank you.
Thank you very much.
From Henry Ford Legion South, from the emergency department, patient advocate Jill Phillip, and the chief or the clinical nurse manager of the ED, Joanna Plate.